Everybody. We're going to be getting started now on this week's CareOptimize Insights 2020 webinar series. We will be discussing the regulatory expansion. So topics today include CMS second round Medicaid provider grants, telehealth expansion, elective surgeries, loans and grants, MIPS submissions, and CareOptimize solutions. So CMS has a second round of widespread regulatory changes. The first topic that we'll discuss today is with ACOs. So CMS has decided to adjust the financial methodology to account for COVID-19 costs to ensure that Medicare ACOs will be treated equitably regardless of the extent to which their patients are affected by the pandemic. CMS is also forgoing the annual application cycle for 2021 so that ACOs whose participation is slated to end this year have the opportunity of extending for another year and allowing ACOs to maintain their current financial risk level for next year instead of automatically being advanced to the next risk level. Antibody tests are covered, so Medicare and Medicaid will cover FDA-authorized antibody tests. These tests may help determine whether a person has developed an immune response and may not be at immediate risk for a COVID-19 reinfection. There's still a lot of testing that needs to be done on the antibody tests, but hopefully, if you build up some antibodies, then that would help reduce your risk of infection if you were to come in contact with the disease again. Okay, we have hospital payments. So as mandated by the Coronavirus Aid, Relief, and Economic Security Act, long-term acute care hospitals will be paid at a higher Medicare rate if they accept patients from acute care hospitals. And hospitals will be paid for seeing Medicare patients and collecting samples for COVID-19 tests, even if those are the only services the patient receives. And the last item on this slide is in regards to COVID-19 testing. CMS will no longer require a written order from a practitioner, and a pharmacist can now perform certain COVID-19 tests depending on state law. CMS will pay hospitals and practitioners for seeing Medicare beneficiaries. All right, so our next topic today is CMS second round home health changes. So there are a lot of patients now that aren't going into the doctor's offices, or they need home health, like more care to be completed at home. So there were some changes that took place. So since beneficiaries may need in-home services during the COVID-19 pandemic, nurse practitioners, clinical nurse specialists, and physician assistants can now provide home health services as mandated by the CARES Act. The practitioners can now order home health services, establish and periodically review a plan of care, and certify and recertify that the patient is eligible for home health services. Previously, Medicare and Medicaid home health beneficiaries could only receive home health services with a certification of a physician. These changes are effective for both Medicare and Medicaid. Okay, so in previous weeks, we were talking about accelerated payments. But about a week and a half ago, CMS suspended accelerated payments. So they suspended the advanced payment program. It was effective immediately as of about a week and a half ago, and they will be reevaluating the money paid under the accelerated payment program. So the move came after CMS made over $100 billion in payments to provider organizations battling COVID-19, and the Accelerated Advanced Payment, or AAP, programs were expanded in late March to assist hospitals and health systems facing financial issues associated with caring for infected patients. But that's currently been suspended. So if anything changes with that, we will let you know. Okay, now on to Medicaid provider grants. So on Friday, CMS asked states for provider-level Medicaid fee-for-service and managed care revenue information for 2018 and 2019. The deadline was Tuesday, but many states have requested extensions. That may be a turn toward Medicaid center support, which has been left out of much of the funding program so far. So some additional information regarding the CARES Act from HHS is they have been allocating billions and billions of dollars, and some of the money is going to be distributed for targeted facilities. So one is the allocation for treatment of the uninsured. So every healthcare provider who has provided treatment for uninsured COVID-19 patients on or after February 4th can request claims be reimbursed through the program and will be reimbursed as Medicare rates subject to available funding and attesting to certain requirements. This submission began yesterday on May 6th. You can register at HRSA COVID Uninsured Program portal. There's also funding that was going towards patients that were hit in high impact areas. So on May 1st, 2020, the U.S. Department of Health and Human Services announced that it would start distributing about $12 billion to 395 hospitals that provided inpatient care for 100 or more COVID-19 patients through April 10th, 2020. Rural providers will also be receiving money. So hospitals and rural clinics will each receive a minimum base payment plus percentage of their annual expenses. And Indian Health Services also received allocation to go towards their facilities and help pay operating expenses. Okay, moving on to the expansion of telehealth programs. So telehealth programs used to take about 2 years to implement, but the pandemic focused on expanding capacity, and it has been reduced to about 2 weeks to implement a telehealth program at a doctor's office. So with this accelerated implementation comes the very real possibility that these telehealth initiatives will carry over post-pandemic. So everybody now has the tools and has been doing it, so it might become something that we still do even after the pandemic ends. So some key changes that have occurred in the expansion of the telehealth programs. So physical occupational speech therapists are now able to practice telehealth. CMS expanded the list of audio-only phone services reimbursable through Medicare to include many behavioral health and patient education services, and the agency is increasing reimbursements for those services to match similar office or outpatient services retroactive to March 1st. They are also not being as strict with the video requirements. They are waiving video requirements for certain evaluation and management of services, enabling providers to bill Medicare for services delivered by audio only. And now federally qualified health clinics and rural health clinics can be reimbursed for providing telehealth services. Okay, elective surgeries. I'm sure you've heard that some states are now allowing elective surgeries. This number is changing constantly. Just a few days ago it was lower, but in some recent research, more states have indicated that they will begin resuming elective surgeries. Many are doing a phased-in approach based on the AHA guidelines. So they need to establish prioritization policies, different committees, surgery, anesthesia, nursing leaders that can prioritize what patients need these elective procedures completed first. And there are also some additional requirements Testing would be another major pillar of any plan to resume elective surgeries. So a facility should account for the time and frequency of testing patients to try to make the testing as quick as possible. Okay. Small Business Association, Paycheck Protection Program, loans to grants. So a lot of this money has gone so far, but there is still some money left. So the second round of funding is coming, or we're actually currently in it. 75% of money must be used to pay employees with no layoffs. 25% of the money you receive may be used towards expenses like your rent and utilities. And if you follow these guidelines, then the loan would be forgiven and then become a grant. Okay, but you can't let people go. You can't try to use that money to expand your business. It just has to go towards daily operations. It's still first come, first serve, and you still have to work with the bank that you have always been working with. You can't switch banks and try to go through somebody else. The average wait time for this loan is 11 days, and we recommend to just keep in contact with your bank if you haven't heard from them. Try to be persistent, and that's pretty much it. Okay, so back to the HHS grant. If you did receive money from the CARES Act or HHS grant, if you've already received some, or if you notice that you do receive some, because there is more money coming, you need to complete your attestation and document that you did in fact receive your money. And the link is on the screen, covid19linkhealth.com. Okay, MIPS submissions, if you are participating in MIPS, those submissions were due on April 30th. So MIPS eligible clinicians who did not submit by the deadline will automatically receive the extreme and uncontrollable policy applied. So that means that you're going to have a neutral payment adjustment for 2021. So that's good. However, if you would have possibly received a bonus, then you will just receive a neutral payment if you did not submit. If you did submit and you exceeded the criteria for met exceptional, then you will receive a bonus just like you always would have. Okay, CareOptimize is offering complimentary COVID-19 templates. So if you do have some COVID patients coming in and you're struggling to document everything that you're doing with them, we offer a complimentary template. So this template, and we also have a corresponding document, walks your providers through the process of handling a potential coronavirus case. It screens for other potential causes and symptoms like pneumonia, influenza, things like that. It also, as you can see on the screen, lets you document if the patient would be tested for COVID-19, if results came back in, was the patient wearing a face mask, did you take their temperature, who was in contact with them, how long were you in contact with them, and things like that. Besides the complimentary template and document, we also have a CRISTA report that will show all of your high-risk patients. And in that report, it's good to have so that you can call your patients and keep up with them and see how they're doing, making sure that they're, having proper hand hygiene, making sure that they're still able to get the food that they need if they're, afraid to go out or something. So moving on. All right, and that's all that I have for today. So today we covered things from the CareOptimize website, YouTube, the QPP website, COVID-19, CMS websites, and Health Intelligence. And if you have any questions about the presentation that I gave today, or if you would like to receive the complimentary COVID-19 tools that we offer, please send me an email, lauren.picone@careoptimize.com, or you could also email us at info@careoptimize.com. And that's all